Hey guys, Dr. Browning here. I'm going to show you today a cool case study of a patient who had spinal surgery in the past. It was failed, it did not help, and was in chronic pain for years, and now is a chiropractic patient and is doing great, feeling much better and having great success. So one of the misconceptions I would say of spinal surgery is that people think it's this automatic fix. It's just gonna, stay the same afterwards. And as a lot of people find out, that's not the case, and it may not be any better. It could be worse. And many times, chiropractic care can actually prevent the need for the surgery. Every case is different, but initially we just need a good chiropractic examination, the X-rays, and then that can determine whether the person would be a good candidate for chiropractic care or not before having surgery. So let me go ahead and show you. Come on into the consultation room here, and I'm going to show you this X-ray right here. Okay, so here you go. We're facing that way, so this is the side view of the neck that you're getting to see, and you can see the vertebra coming down, and I think you probably noticed the lovely metal there in the neck with the screws. There's a couple screws at each point there. So what it's doing, so see these vertebrae down here, and really every vertebra in the spine all the way, they function together, but they also move independently. They have their own range of motion. Now these two, essentially, since they're fused together, they now move and function as one. And so what that does, it limits the range of motion to that particular area. So in this case, the entire neck will have less range of motion. So that would give the person the feeling more of stiffness or of compression, just like they just can't move as well. And that's the case forever after having a fusion. One of the difficulties are when there gets to be pinching or stress on the nerves, it's tougher to get it off of there because of the lack of motion. So this person, even with this, is a great candidate for chiropractic, and believe it or not, is doing exceptionally well, feeling much better, getting better motion overall, and just as important, I would say, is learning how to take care of the spine now. And this was one of those cases, would have been perfect to have had this patient before the surgery, could have been prevented, but in this case, at least it's helping a lot now. So I would say if this happens to you, or of someone in this case, have them to go to a good chiropractor, be fully evaluated, have the X-rays taken. Let's determine, if a conservative chiropractic approach can help or not. And then you can always have the surgery later, but you cannot undo what has now been fused. So that's my tip of the day, and I hope you enjoyed it and have a great day. Thanks.